Hello, dear friends. Welcome to our channel PKR Vibes Career and Growth. First of all, thank you so much for your time to spending here to learn something new today. Today, we'll discuss about UB4 medical claim form, the boxes from our field locator 50 till 65. These boxes from 50 to 65 having third party information. And before that, I already uploaded the boxes 1 to 50 videos in our channel. If you not yet visited, or if you want to know more information about the boxes 1 to 50, I will provide those videos links in the first comment of this video. Would you like to know more information? You can kindly explore those links. And this UB4 claim form is also known as a CMS 1450 claim form in healthcare, US healthcare domain, or in medical billing. Why? Because generally the hospitals or nursing home facilities or rehabilitation centers and the chronic dialysis centers and some adult day healthcare institutes and some other healthcare institutes are using these UB4 claim forms to submit inpatient claims to insurances to get the benefits to the doctors. And also some other centers are there, they are using to submit outpatient claims also to the insurance companies to submit the medical claim forms by using UB4 medical claim form. So here, for example, ambulatory surgical centers, they are not admitting patient into the hospital like a 24 hours, so more than 24 hours. So whatever the service the patient is required from that ambulatory surgical centers will be done in a day, nothing but it will be done within 24 hours. So that kind of service is known as ambulatory surgical centers. For example, any small surgery is required, it will be done within a day, so that is ambulatory surgical center. That kind of claims are known as a outpatient claims generally. So we have to understand that here UB4 claim forms is used to submit both inpatient as well as a outpatient claims to the insurance companies. So yeah, generally it will be done by institutes are mostly using UB4 claim forms. So that's why it will be called as a institutional billing. And also hospitals also using this UB4 claim forms to submit inpatient claims. So that is why it is also known as a hospital billing. We have to understand that basic concept. And we have to understand one point. This UB4 claim form was developed by CMS, Centers for Medicare and Medicaid Services, and approved by NUBC, National Uniform Billing Committee. Guys, before we are discussing about boxes 50 to 65, if you are watching our video first time and if you not yet subscribed, could you please subscribe our channel PKR Vibes Career and Growth, and also hit the bell icon so that you will get every our video as a notifications to your mobile. Okay guys, here location 50 and UB4 claim form is about insurance name. We have to enter on the location 50. Insurance, we all of you know, right? It is also called as a payer or entity. So this insurance name should be presented on a location 50. Okay guys, here location 51 on UB4 claim form is health plan ID. See on health plan ID we can see on a member ID or policy ID. So that ID number should be represented or entered on a location 51. Okay guys, now we are discussing about location 52 on UB04 claim form or CMS 1450 claim form. See here, location 52 is telling that patient authorized information, like for example release of information certificate. So release of information is nothing but patient is signed or agreed or authorized to release the medical information to the insurance companies. Sometimes what happen, a medical claim should be processed if they want complete information of other insurance details, for example COG confirmation or some other things. So at the time insurance need confirmation from the patient that we want this medical information from the patient. So otherwise sometimes they want patient medical records, or otherwise they want a patient consent, or patient confirmation in any way. At the time, patient should have to release that information to the insurance companies to process the claim towards the payments to the doctor. So this kind of information is patient need to provide to the insurance to process the claims. This is called release of information. If patient is not agreed or not authorized or not signed, then this claims will be not processed towards the uh, payments to the doctors. So every time we have to check the release of information is uh, authorized or not. If it is authorized, we can see on claim form Y, nothing but S. Please note this point. Okay guys, now we are discussing about the location 53 on UB04 claim form or CMS 1450 claim form. See here location 53 telling about assignments of benefits. Here benefits are nothing but payments. So simply here the payments. So here assignment of benefits are nothing but here patient should have to signed on a assignments of benefits documents. So what is the assignment of benefits is nothing but doctor, patient should have to sign to give the benefits, insurance to the doctors directly. So if the patient is not signed, insurance is not giving the benefits to the doctors directly. So generally what happen, we submit medical claim to insurance company should process the claim, I mean should process and pay the claim to doctors, right? So if the assignments of benefits is not authorized or not signed by the patient, nothing but it's not acknowledged by the patient, then the assignments of these benefits is not given to the doctors directly. So these benefits should go to the patient. If the patient is not authorized, or if a doctor is not signed, doctor is not makes the patients to signed, then the benefits directly go to the patient. So always doctor also aware this thing that patient should also signed this assignments of benefits. It's telling that insurance is giving the benefits to the doctors directly. If the patient is authorized, acknowledged or signed, then it should be yes. So there is a unclaim from Y, it is telling that yes. So please you have to note this point. Okay guys, now we are discussing about location 54 on UB4 claim form, and it is telling about prior payments. So simply if you are submitting claim to any insurance, if already previously we got a payments or from the insurance, other insurance, or you are submitting to secondary insurance, so if you are a primary payments, then you have to enter here, or otherwise if you are submitting partially claim to the primary insurance, we got a payments for the from the same insurance, then also you have to enter the prior payments in the location 54. Okay guys, location 55 is telling that estimated amount due. If we are looking for amount, how much amount should be estimated amount we are getting from the insurance, that amount should be, if anything amount is left over, that amount due is will be on this location 55. Okay guys, yeah, now we are discussing about location 56 on UB4 or CMS 1450 claim form. See, here location 56 telling about national provider identification number. It is a NPI number. It is like 10-digit number. It is in the format of a 334 format. It is NPI number. We can see on 50 number, I mean sorry 56, we can see that NPI number on a UB4 claim form. Guys, if you know who will issue that NPI number, you can please comment to this video so that I can understand that everyone also have the uh, answer for that, who will issue the NPI number. Okay guys, on location 57 on UB4 claim form, we can see that other provider ID information apart from national provider identification number. If you found any other provider ID, you should have to bill to the insurance. You can mention on a 57 box. Okay guys, now we are discussing about location 58 on UB4 claim form or CMS 1450 claim form. So it is telling about insured's name. The person who is giving premium to the insurance is known as a insured. So and the person who is also active with the insurance company by paying premium to the insurance on every in regular intervals is also known as a insured. So simple, the name of that person insured, insured's name we have to enter on the field of 58. So we all of you know that, okay, the format while you are submitting or while you are entering on a claim form, medical claim forms to the insurance companies, the format is last name comma first name comma middle initial. So that is the format only you have to enter. If you are not entering in the format of last name comma first name comma middle initial, then insurance will not understand and insurance will might reject or deny your claim for the uh, demographic informations, or your information is not valid. They will tell the reason for the rejection or the deny for the rejection, I mean deny for the claim. So for example, you have to enter this name every time. You have to note this point, okay? So sometimes we have to enter the mother's name if billing for an infant using the mother's ID. So if any other circumstances, please leave blank. Okay guys, now we are discussing about location 59 on UB4 claim form or CMS 1450 claim form. It is telling about patient relation to the insured. So for example, you are giving premium to the insurance company and your policy is active. So you are also very active every time you are giving your premium in times to the insurance. So you are active insured to the insurance. So and for example, you are giving premium and you are a policy holder, but you are in your family some other person is covered. For example, your spouse is also, or your child is also covered in your policy, but you are a policy holder, but your child is also covered. So now your child is get into the effect, so your child is become like a patient. So you are submitting claim on your like patient name as your child, then you should have to enter your patient's relations to the insured. So that is what here the location 59, always the patient is not insured. So that is what here we have to enter the relation. For example, patient relation to the insured is a child or a spouse or someone else. So here the point is we have to understand that it is a patient's relations to the insured on a location 59. Guys, location 60 is like on UB4 claim form is about insured unique ID. So that unique ID should be entered on a box number 60. So please aware about this basic details, or this the name, unique ID, everything. So the about location 60 is about the insured unique ID. Location 61 is telling about insured group name. So the name of the group will be entered on the location 61. Okay guys, location 62 on UB4 claim form is telling about insured group number. Just now we are discussing about 61 is a insured group name. Here it is a group number. So just we have to await that insured group name and number is available on the locations 61 and 62. Okay, guys, now we are discussing about location 63 on UB4 claim form or CMS 1450 claim form. Here, location or field or box 63 is telling about treatment authorization number. See, you know, authorization number should be entered on location 63, that is called as a treatment authorization codes. So we all of you know that in CMS 1500 claim form the authorization number should be on a box number 23. So coming to UB4 claim form, it should be on a 63. So generally we already know that authorization number is nothing but an approval a provider will obtain or will get from the insurance company. For example, before service is given to the patient, if the doctor is obtained from the insurance, it is known as a prior authorization. For example, the service is given to the patient but there is no authorization obtained, but it is as per service based, as per medical records, as per service necessity, the authorization required, but a doctor is missing to require that information, and the claim is filed to insurance, then insurance is denied stating that authorization is required. So at the time doctor realized that okay, uh, they are not obtained the authorization which is really required. At the time, you, as a AR caller, you need to call and you should have to ask that is there any possibility to get the retro authorization. Retro authorization means after the service is given, if you bill the claim to insurance, insurance is denied for authorization. After that, doctor realizes that okay, authorization is required, then if you are obtaining from the insurance companies to process the claims, to deny the claims, so to process the denied claims, we obtain the authorization from the insurance company, then it is called as a retro authorization. So simple, authorization is nothing but an approval from the insurance company. The doctor will obtain that information from the insurance. So that is about the authorization. Okay, now we are discussing about location 64 on UB4 claim form. It is nothing but DCN number. So DCN is nothing but document control number. For example, if you are submitting any appeal to the claim, so if insurance is telling that yes, appeal is in the process, nothing but appeal is in uphold. Hold means HOLD. Uphold means it is a hold, still in process. So at the time you are asking like, is there any reference number? Then they tell that okay, there is a, for example, DCN number is there, document control number. It is like a, indirectly it is like a claim number. But if claim is denied and denied UOB, we will see the claim number, or it is also known as the internal claim number, ICN. But if you are submitting any documentation to the insurance and after reviewed, the insurance will deny that document, if for example, or the documentation is in process, at the time they will provide DCN number, document control number. This is about 64 location. Okay, coming to location 65 is telling about employer name. Guys, if you are watching our video first time and if you not yet subscribed, could you please subscribe our channel PKR Vibes Career and Growth and hit the bell icon so that you will get every our video as a notifications to your mobile. And if you felt content is useful, could you please like our video also so that it will reaches many more needy people. And again, thank you for your time and thank you for watching. Have a good health. Bye for now.